Welcome to Unit 1, Section 4, Assessment Techniques. In this lecture, I'm going to give you a little more information regarding resisted range of movements before we work our way through the demonstration videos. Resisted range of movement tests are carried out last. These will give you information on active structures such as muscles and tendons, and will give you information such as pain and weakness. Often both sides will be tested at once, but if not, start with the good side first, repeating the same range of movements as you've already carried out. The benefit of testing both sides together means you are more likely to notice differences between both sides if there is a weakness. Beware here, things like hand dominance, i.e. left or right-handed, could show through, or someone with a job that has a repetitive movement which will make one side stronger than the other. You can ask questions here about work hobbies, hand dominance, etc. to help you decide. Other things to look for are things like shuddering or shaking when they are resisting, which would show a sign of weakness or poor control within the muscle. It needs to be a good strong resistance, but there should be no movement, so explain to your client first what you want them to do. These additional tests will give you a greater breadth of insight into the issue and potentially allow you to eliminate structures. Whether carrying out active, passive or resisted range of movement tests, the information you will need to consider and gather is when and where does the pain occur during the range? What sort of pain is it and how painful? Does the pain occur every time? Does the movement make the pain worse, or does it decrease with repetition? What is the client's reaction to the range of movement? Look for things like facial expressions or a reluctance to go through that range. Do they actually have full range of movement? Is there a restriction within that movement? Are there any compensatory patterns? Quite often people will move their head towards their arm to create a full range of movement in abduction. And what is the overall quality of movement like? Is there any weakness in the muscles or juddering? Do any of your findings differ between active, passive and resisted? It's a lot of information to think about, but it is important. Even if you're not sure what this information means, gather as much as you can. You may understand it at a later date, but it will help you to mark improvements or even decline after treatment. So key points to remember: communicate well with your client. Explain exactly what you want them to do. Remember, they are resisting you, not you resisting them. It's not a show of strength, so don't let them or you get carried away. On the course, you need to repeat all the same tests for active, passive and resisted, but when in clinic, you will whittle them down from the active ranges, choosing only to carry out the positive tests. You can now complete the quiz associated with this section and then move on to the demonstration videos.